Pregnancy is so much more than just a growing belly. It's a complete physiological overhaul. So today, we're going to map out that entire transformation visually. We'll connect the dots from the very first hormonal shifts all the way to the head-to-toe changes that make it all possible. By the end of this, you'll have a clear, step-by-step picture of the why behind it all, which is exactly what you need to feel confident for your exams. All right, so here's our game plan. First, we're going to tackle how we even know for sure that a pregnancy has started. Then we'll dive into the incredible domino effect of changes that ripple through the entire body. After that, we'll see how those changes show up as common discomforts, learn how clinicians actually monitor this whole journey, and finally, we'll touch on the key risk factors to watch out for along the way. All right, let's kick things off right at the beginning. How do we go from just a hunch, a simple suspicion, to a definite, rock-solid medical diagnosis of pregnancy? This is the question, right? The one that starts it all. But in a clinical setting, knowing for sure means a lot more than just a home pregnancy test. It's really about breaking down the clues one by one into different categories of evidence. Okay, this is a super important distinction to get. On the left, we have what are called presumptive signs. These are all the things the person feels themselves. Nausea, feeling tired. They're clues for sure, but they're not proof. Then on the right, we have probable signs. These are things a doctor or nurse can actually observe. But get this, even a positive pregnancy test is only considered probable. So, why is that? Well, because in very rare cases, other medical conditions can actually trigger a positive test. It's not 100% foolproof. So what's the 100% no doubt about it gold standard for confirmation? Only these three things. The positive signs. You can actually hear the fetal heartbeat. A trained examiner can feel the fetus move, or you can literally see the fetus on an ultrasound. That's it. Full stop. Everything else is just strong evidence. Remembering this difference is absolutely key. All right, so pregnancy is confirmed. Now the real magic begins. This is where we get into the core pathophysiology, and it's truly a domino effect. A couple of key changes kick things off, and that triggers this huge cascade of adaptations in every single system of the body. And honestly, it pretty much all starts right here. To support the placenta and the growing baby, the body ramps up its total blood volume by a whopping 40 to 50%. Think about that. That one single massive change is basically the engine driving almost everything that happens in the cardiovascular system during pregnancy. And the other big driver? It's just simple physics, really. Just take a look at this diagram. As the uterus gets bigger and bigger, it pushes the diaphragm up. And that physically shoves the heart up and over to the left. It's like a total reorganization of your insides, all because of that growing uterus. Okay, let's connect the dots now. So you have all this extra blood volume, right? But here's the thing, it's not perfectly balanced. The plasma part of the blood increases more than the red blood cells. This leads to a dilution effect that we call physiological anemia, and it's why iron requirements go through the roof. And meanwhile, that diaphragm getting pushed up, well, it's squishing the lungs, which is the direct cause of that classic shortness of breath. See how it all connects? And believe me, this cascade keeps on going. The hormone progesterone chills out smooth muscle, which is great for the uterus, but not so great for your digestive system. It slows everything down, leading to things like heartburn and constipation. And mechanically, that growing uterus is sitting right on top of the bladder, causing that frequent need to use the restroom. It's a true total body transformation. And if you really want to wrap your head around just how much pressure we're talking about, get this. The uterus itself goes from being about the size of a pear, weighing around 60 grams, to weighing 1,000 grams by the end. That is a staggering 15 times increase in weight. It literally becomes one of the biggest and strongest muscles in the body. So we've looked at all the behind-the-scenes mechanics. Now let's talk about what this all actually feels like. This is where the science really meets the symptoms, and we connect the what to the why. This chart just lays it out so clearly. Heartburn? Well, that's a direct hit from that progesterone slowing things down, plus the stomach literally getting squished out of place. That constant need to pee? Yep, that's pure mechanical pressure from the uterus on the bladder. Ever wonder about nasal stuffiness? That's from increased estrogen causing swelling in your nasal passages. And that classic pregnancy backache? The uterus pulls the center of gravity forward, forcing the lower back to curve more to compensate. You see, every single one of these common complaints has a clear physiological reason behind it. Okay, so with all this crazy stuff happening inside the body so fast, how in the world do doctors and nurses keep tabs on everything to make sure it's all going smoothly? Well, that brings us to the tools they use to monitor the health and growth of the pregnancy. Well, one of the first tools in the toolbox is something called GTPAL. Think of it like a secret code for clinicians, a really fast way to summarize a person's entire pregnancy history. G is for gravidity, the total number of pregnancies. T is for term births. P for preterm. A for any abortions or miscarriages. And L is for the number of living children. Let's make this super clear with an example. Okay, so a patient is pregnant for the fourth time. Simple enough. G is 4. They've had one baby born at term, so T is 1. One baby born preterm, so P is 1. One abortion, so A is 1. And they currently have 2 living children, so L is 2. The final GTPAL score is 41112. It's a super concise summary of a really complex history. All right, so what about tracking the current pregnancy's growth? For that, we can use a tool that's surprisingly simple, measuring the fundal height. Remember that incredible uterine growth we talked about? Well, what's amazing is that its growth is incredibly predictable. After about week 18, the height of that fundus, measured in centimeters, is going to be almost exactly the same as the number of weeks of the pregnancy, give or take a couple centimeters. And measuring it is actually super simple. You have the patient lie down, and you just take a tape measure and place the end right at the top of their pubic bone. That's the symphysis pubis. Then you stretch the tape up to the very top of the uterus, which is the fundus, and you record the measurement. It's a fast, easy way to make sure the baby's growth is right on track. Okay, now for checking on the baby's actual well-being, there are 2 really important tests to know. The first is the non-stress test, or NST. We're basically just watching the baby at rest. We want to see the heart rate speed up a bit when the baby moves. That's called a reactive test, and it's a great sign. The other is the contraction stress test, or CST, which kind of mimics labor. Now, this is where it gets a little tricky, so pay attention. For this one, a negative result is what we want. That means the baby handled the stress of contractions just fine. So remember, reactive is good for the NST, and negative is good for the CST. Okay, last section. Look, while pregnancy is a totally natural process, we have to be real. It's not always a smooth ride. So let's quickly go over the key factors that can complicate this journey and really require closer attention. So here's a quick rundown of the big ones you need to have on your radar. Age is a big one, being younger than 20 or older than 35. A lack of access to care, both prenatal and even dental, is a factor. Of course, pre-existing medical conditions like diabetes or high blood pressure play a huge role, as does any kind of substance use and certain infections. But for all the risks we talk about, there's one thing that is just an absolute game changer for prevention. This quote right here is a critical public health message. Taking folic acid before and during early pregnancy has been proven to drastically reduce the risk of really devastating birth defects like neural tube defects. It is such a simple intervention with a truly profound impact. All right, let's zoom out and put it all together. We started with just a single confirmed pregnancy. And from there, we saw how it triggers this incredible, perfectly synchronized cascade of events. From blood volume nearly doubling to hormonal shifts re-engineering entire body systems, every single change we've talked about works together to support and grow a new life. And that is why all of this matters so much. Because when you truly get the why behind every little change, you're not just memorizing facts for a test, you're building real clinical intuition. It really makes you stop and think, doesn't it? Is there any other process in the human body that is this completely and utterly transformative? Something to think about. Thanks so much for joining me today.